So we had a 22-year-old female that came in today for a routine physical. Her level of consciousness was ANO times 4. Her body weight is appropriate for her height and build, and her body fat is distributed evenly throughout her body. Her posture is relaxed and erect. Her gait was unlabored, with no pain, no use of assistive devices, or presence of any involuntary movements. There was no obvious physical deformities present. Her mood was calm and appropriate for the assessment. The patient was well groomed. She spoke fluent, clear, understandable English. Her hair was fine and had a head full of hair. There was no lesions on the scalp or dandruff present. Her head was normocephalic. Eyebrows were even, eyelashes distributed evenly, and her eyes had no signs of discharge or redness. The conjunctiva was pink and moist. The sclera was white with no yellow tinting. The cornea was clear with no cloudiness. The iris was flat and round with an even color distribution. Perla present bilateral. We did the field of gaze, the ocular motor, trochlear, and abducens was present. Those cranial nerves were present. The nose was midline with no discharge, lesions, redness, or pain. The nostrils are even and symmetrical and patent bilaterally. Olfactory nerve was present. The temporal arteries were present with no limitations. The frontal and maxilla sinuses, there was no pain on palpation. Her lips and mucous membranes were pink and moist. There was no cracks, sores, or lesions. All adult teeth were present. They were white in color with no food or debris or any decay noted. Her hypoglossal nerve is intact. Her tongue was pink with ridges. Her hard palate is white with transverse rugae and a soft pink palate. The tonsils are present with no swelling, redness, or tenderness noted. Her glossopharyngeal and vagus nerve were also present, and the uvula is midline. The carotid artery was palpated with no brueries noted. The vestibule cochlear nerve for hearing is also present. Their ears are even bilaterally. No pain or tenderness or no discharge or redness were present. The trachea is midline and symmetrical. Thyroid gland is palpated with no pain or lumps noted. The skin color is consistent throughout the entire body with no tinting present. She did not have tattoos or piercings. Her arms had a full range of motion with no muscular weakness bilaterally. Her nails are clean. Her hands are clean. Her nail beds are clean and they're cut short with no debris under her fingernails. The cap refill was less than 3 seconds. The posterior thorax and lungs were inspected, auscultated, and palpated. The lungs were clear bilateral in all 5 lobes with no adventitious breath sounds. There was no pain upon palpation or CVA tenderness noted. Let's see, the heart, the S1 and S2 were present, no S3 or S4 auscultated. The apical pulse was palpated at the 5th intercostal space at the mid-clavicular line. The abdomen was soft, flat, and non-distended. The umbilicus is central. There was no discharge or lesions or pain. There was active bowel sounds in all 4 quadrants. There was high-pitched gurgling noises when auscultated. No pain or tenderness upon palpation. Tympany was in all 4 quadrants when percussed. And the bilateral extremities were symmetrical as well, with full range of motion in the hips, knees, ankles, and feet, with no limitations, pain, or stiffness. Her femoral, popliteal, posterior tibial, and dorsalis pedis pulses are also present upon palpation and equal bilaterally. They were strong and bounding. The patellar reflexes show no signs of abnormality. And then per the scoliosis screen, her spine is straight with no bulges or curvatures, as well as no hip displacement.